So some of the characteristics of perpetrators, again, they tend to mostly be male, and they often are manipulative and do not show remorse or empathy. They tend to approve of violence against women. They may have a history of domestic violence, things like that. They also tend to accept certain myths about rape and sexual assault. So for example, they may believe that women actually enjoy being forced to have sex, which is obviously not true. They often are more likely to misinterpret social cues, so they may think that a girl being friendly to them is actually being flirtatious or seductive when that's not her intention, she's just trying to be friendly. Perpetrators sometimes will have a past history of childhood sexual abuse themselves. They're more likely to have been sexually promiscuous in adolescence, and also more likely to use substances, particularly alcohol. So all those characteristics contribute to the likelihood that someone will engage in sexual assault. In addition to that, there of course are cultural factors that have led to an increase in sexual assaults, particularly on college campuses. In the US, in a lot of Western cultures, men are often taught to be dominant and competitive. We've kind of talked about that through childhood, those gender typing and gender stereotypes. Women, on the other hand, are often taught to be more submissive and passive. Our culture also has a pretty high acceptance of violence, so in media, movies, things like that. And in addition to that, we have a lot of media that portrays sexual coercion as a positive thing. A lot of pornography will show women being coerced into sex and make it look like that's something that's enjoyable to them. And so if a man is watching a lot of that type of pornography, then that can kind of dull their sensitivity and sort of, basically mess up their perception of what women enjoy. So all of those cultural factors contribute to the likelihood that there will be, sexual assaults, rapes, things like that. Some of the consequences of experiencing sexual coercion. Immediately after it's happened, victims will often experience shock, confusion, and PTSD symptoms. In fact, I would just take off the word symptoms because a lot of people who experience sexual assault do develop post-traumatic stress disorder. Symptoms of that would include things like intrusive thoughts, nightmares, sometimes irritability, things like that can follow a sexual assault. In the long term, though, they can experience fatigue, depression, substance abuse, social anxiety, difficulties with intimacy, and suicidal thoughts. It's also fairly common following a sexual assault or during a sexual assault to have physical injury. And then in addition to that, of course, a risk is STIs or STDs in pregnancy. About 4 to 30% of sexual assaults result in contraction of an STI, and about 5% result in a pregnancy. And it's also been shown that someone who has experienced sexual coercion or sexual assault will have just general health issues above, the average population. They tend to have, psychological issues as well. I guess I kind of talked about those there. So all kinds of long-term side effects of having experienced this. Some suggestions for preventing and treating sexual coercion. I think number one for preventing is to teach men not to engage in sexual coercion. Again, unfortunately, a lot of prevention programs are targeted at victims, like what victims can do to avoid it. But you obviously need to stop men from engaging in coercion in the first place. And again, I keep saying men because that is the prominent, that's the most common. But again, there are cases where women engage in sexual coercion as well. There are community service that are offered. These are mostly targeted towards women who are in like a domestic violence situation where they're having repeated physical and sexual assaults. There's safe houses, for example, where women can go if they need a safe place to escape from that. There's crisis hotlines that women can call in kind of a secretive manner so that they can get help. Support groups and legal aid as well. A lot of these, however, are very underfunded and cannot serve everyone. And there are few of these services that exist specifically for victimized men. Most of them are targeted towards women. If someone has experienced a rape, it is vital that they get therapy. Individual therapy is very helpful, but it's been shown that group therapy is particularly helpful. It gives them someone that they can relate to, but it also helps them to deal with some of the issues. A lot of women who have experienced rape or sexual assault tend to blame themselves, and oftentimes group therapy can help alleviate some of that self-blame. There are a lot of hospitals and clinics that now do routine screening. So if you go in for like a physical or something like that, or if you go into the ER because you've had an injury, it's fairly common for them now to ask a question along the lines, do you feel, that you have been in danger because of the person you live with or something like that? It's basically a question getting at, are you in a domestic violence situation right now? So that's becoming more common to try to identify people who may be victims. It's also important that the experience of the victim is validated, that they feel like what happened was real and that it wasn't their fault. And then again, this one is more targeted towards women who are in like a domestic violence situation, doing planning to increase safety. So things like getting a restraining order, having police presence if that's necessary, all will help reduce repeated attacks from like a domestic partner, things like that.